So in this video, I'm going to talk about two famous signs that you must know for your Nclex. You will see few questions from this section, right? So first sign is Chvostek sign. I hope you heard about Chvostek sign, right? And the second sign is Trousseau sign. So I'm gonna share some knowledge, and hopefully after that we will do some 6 practice question, and after that hopefully you will be able to crack a lot of answer, right? Right. And also hypocalcemia, low level of calcium, also seen in individual who has a low level of parathyroid hormones. What we call parathyroid hormones, if somebody has low level of parathyroid hormone, we call hypoparathyroidism or vitamin D deficiency, right? Or sometime also if a patient has low level of magnesium, we call hypomagnesia, right? And then you will see this kind of positive Chvostek or Trousseau sign, right? So now I'm gonna show you, some of you must be visual learner, right? So once I show you this sign, when you see the Nclex question, you will be able to correct right away, right? So let me show you how its Chvostek sign look like, right? So C stand for Chvostek, right? And C stand for also cheek muscle, right? So let's say this is my cheek muscle. Either you are positive for Chvostek sign or you do not positive for Chvostek sign, right? So what are you gonna do? So this is a, you have to tap to masseter muscle, right? So this is my masseter muscle. So what you gonna do? You're gonna tap it to the patient, right? Like this. If patient is positive, the reaction will be like this. It's gonna be a lip twitching, like this. If so, that is positive, right? Lips twitching. If there is no reaction while you tapping the masseter muscle like this, if there is no reaction, that's mean it's negative. So now whenever you see question about Chvostek sign, you know, like we have to tap to the cheek muscle, right? And cheek muscle, if the patient has lip twitching, that's positive. Negative. So this is masseter muscle, right? So that is called positive Chvostek sign, right? Now the next thing is, what is Trousseau sign? Trousseau sign, right? So in that situation, what happens? That is also monitoring for low calcium of low level of low level of what do you call calcium, right? Right. So now in that situation, you're gonna ask the patient about their normal systolic blood pressure. So, so let's say if their systolic blood pressure is 120, right? So what are you gonna do? You're gonna take a blood pressure cuff, you put in their arm, and you're gonna inflate. So let's say if their systolic blood pressure is 120, right? You will go above 120. You will go all the way above 130, like that, right? Once you reach 130, you lock it for 3 minutes, right? So you lock it for 3 minutes, and let's see if the patient has any reaction. So what gonna happen? Let me show you. So what's gonna happen if patient is positive for Trousseau sign? You have locked the blood pressure cuff, right? You have inflate for 130, right? And you lock it for 3 minutes. Within 3 minutes, if patient has like this involuntary muscle movement like this towards the body, that means it's a positive sign of Trousseau sign, right? All the fingers must be extended and patient will have like this involuntary muscle movement like this. If there is no movement, that means it's a negative sign. So now you know Chvostek sign as well as Trousseau sign, right? So now let's do 6 practice question, and I hope you will be crack all of the 6 answer immediately, right? So let's try. So let's read the first question. The nurse is concerned the patient is experiencing hypocalcemia following the removal of thyroid, right? In which location does the nurse assess the Chvostek sign? So where you gonna assess the Chvostek sign? As you know, Chvostek start with C. So C should bring you automatically to cheek, right? C for cheek. So Chvostek means cheekbone, right? So our answer come as answer A. Easy, right? Now you know Chvostek means C for cheeks. Next question, a patient on the medical surgical unit is being evaluated after a fall at home, right? He exhibited a positive Chvostek sign. This traditionally indicate what? So if somebody has positive Chvostek sign, that is means patient has a low level of calcium, right? So what we call low level of calcium, uh, that we call hypocalcemia, right? Hypocalcemia. So that's mean answer D is your final answer. Hypo means, so those who are nursing students, first time you are learning, hypo means low, hyper means too much or high. So hypocalcemia. Hypocalcemia means low level of calcium in the blood, right? So your answer is answer D. Easy, right? After that explanation is going to be easy for you to crack all answer. Question number 3. A positive Chvostek sign is mostly likely associated with which of electrolyte imbalance? So tell me, is it hypocalcemia, calcemia, or kalemia? What is that? So Chvostek sign associated with low level of calcium, right? Which would be answer B, hypocalcemia. I hope you got all three answers correct at this time. Question number 4. It is especially important for the nurses to assess for which of the following in a patient who has just undergone a total thyroidectomy. So patient, if they remove the thyroid, it will cause patient calcium level drop, right? So if calcium level drop, what gonna happen? The patient will have answer C, positive Chvostek sign, right? There is no A, no B, no D. Answer C is your correct answer, positive Chvostek sign. Because if they remove, as I mentioned in the beginning, it's associated with individual who has low level of parathyroid hormones, right? Hypoparathyroidism. So if they remove the thyroid hormones or if they remove thyroid totally, that means patient will have low level of calcium, right? So you have to connect all the dots together in order to crack your answer, right? Next question. The nurse is checking the client for positive Trousseau sign. Which finding indicate a positive Trousseau sign? So what is positive Trousseau sign? Facial grimacing? No. Carpopedal spasm? Knuckle rigidity or abdominal tenderness? So when your hand, arm, wrist muscle is twitching towards your body, that's also called carpopedal spasm. Carpal. So this is all your carpal, like either hand or feet. Carpal. So any involuntary carpal muscle movement, that's called carpopedal spasm. So remember this. You have to know this word, carpopedal spasm. Next question, the nurse is assessing the client for Trousseau sign. Which finding indicate a positive Trousseau sign? Tap cranial nerve 7, that would be we do for Chvostek sign, right? Place a blood pressure cuff on the arm and check for carpopedal spasm when the cuff is infiltrated. So that is your immediate answer, right? So as I mentioned, Trousseau sign, you wrap the manually blood pressure cuff, you inflate for like, let's say if your blood pressure systolic number is 120, so you inflate for 130, you will go a little bit above and you lock it for 3 minutes. If a patient has like involuntary muscle hand movement, that's called positive. So that's mean your answer is B for this question. Place a blood pressure cuff on the arm and check for carpopedal spasm when the cuff is inflated. So we did 6 practice question and I hope you got all of your 6 answer right. Right. Good luck. I hope now on you will remember Chvostek and positive Trousseau sign.